Thank you, Mr. Speaker. Mr. Speaker, maybe I'll urge my colleague as you support this motion.
The elders have come to follow our proceedings. Let them follow at least part of proceedings before they leave the house. I think that's very important, that they see how this house works, not how you want to talk to them. So I thought that Honorable Sabina Chege's moving a motion would enable them learn how this house works. That's not why they came.
Thank you, Mr. Speaker. And Mr. Speaker, this motion is also very important for the elders. And I want to urge my colleague, as you support, then you can also welcome our visitors today. Mr. Speaker, I beg to move notice of the following motion, that aware that Article 43(1)(a) of the Constitution provides that every person has the right to highest attainable standard of health, which includes the right of health to care services. Further, aware that Kenyan government committed to accelerating attainment of universal health coverage, UHC, to ensure all Kenyans have access and receive essential quality health services. Cognizant of the fact that in the year 2020, the Ministry of Health adopted the Kenya Universal Health Coverage Policy 2020-2030 with the theme of accelerating attainment of universal health coverage, which is currently being implemented through the introduction of Social Health Insurance Fund, noting that there is need to increase the quality of care and services provided in the public health sector, concerned that the public health care services lack adequate funding to guarantee quality health care services, further noting that the civil servants, public officers, and state officers are accorded a comprehensive medical cover by the respective government agencies, appreciating that the use of comprehensive medical cover by public officers and state officers in public hospitals would guarantee sufficient funding for public hospitals. This House therefore resolves that the government, through the Ministry of Health, implements the Kenya Universal Health Coverage Policy 2020-2030 and introduce a policy on mandatory use of public health care facilities by all civil servants, public officers, and state officers who are using medical cover catered for by the government of Kenya. Thank you, Honorable Speaker. I beg to move the motion. That's a notice of motion.
Yeah, so wait a second. You assist on
and I ask Honorable Muzigi, the women rep and Honorable member from Taita Taveta, to second.
No, this way. The Honorable Sabina Chege, this, what up? This is, you're now assistant member, the Honorable Sabina Chege. This is your chance to debate this motion. So you've just read the motion. Could you then now tell us what is it that you want the House to do? As usual, then you will ask the member you've appointed to second for you.
Thank you, Mr. Speaker. Mr. Speaker, I would say this motion, I've personally moved it out of experience of what I've gone through the public health facilities, having been a former chair of health committee, and I can see Honorable Nyikali is also in the House, and what we experience, Mr. Speaker, even at the constituency level and our villages level. Mr. Speaker, currently our hospitals or our healthcare starts from level 1, which is at the community service, all the way to level 6. And currently in the nation of Kenya, we only have 6 public health level 6 health facilities, which includes the Kenyatta National Hospital, the Kenyatta University Teaching and Referral Hospital, we have the spinal injury, we have Moi Teaching and Referral Hospital, we have Odhaya, and we have Mathari Mental Hospital, Mr. Speaker. Mr. Speaker, the definition of universal health coverage is a key global health goal that ensures that all people have access to essential health services without facing financial hardship. It is crucial for achieving health equity. The Constitution in Article 43(1)(a) of the Kenyan Constitution guarantees that every citizen, and I want to mean that, has the right of the highest attainable standard of health. This legal foundation is essential for driving UHC forward in Kenya. And the Kenya UHC Policy 2020-2030 gives that the Kenya Universal Health Coverage Policy is aimed at expanding access to affordable health services for all citizens with a particular focus on social health fund, which is SHIFT, to improve health financing and service delivery. what are the current challenges are we facing in health facilities in Kenya, in healthcare system? The biggest and the main one is funding constraint, where for us to achieve UAC in Kenya, we lack sufficient funding for the public health care. Public hospitals are often underfunded, limiting the ability to provide quality services. And Mr. Speaker, I know even in this house, through SHA, we are being deducted a lot of money to go to this funding of health. But Mr. Speaker, I'm more than convinced. If we are able to equip our hospitals, our public hospitals very well, if we are able to have enough doctors there and nurses and the staff to take care of the patients there, if we are able to have enough medication, we might not need a lot of deduction of our financing that we are getting even from our pay slips, and not only us, but by all public officers and anybody who have a pay slip. But Mr. Speaker, even when this money is deducted, where is the huge chunk of the money going for? Is it to the public facilities where normal wananchi, where the people you represent here go to? Or do we find that this money ends up in the high-end hospitals where only a few Kenyans can be able to access and afford, Mr. Speaker? The quality of care, Mr. Speaker, in public health services, especially in rural areas, suffers from inadequate staffing, outdated equipment, and lack of essential medicines, resulting in significant disparities in service delivery. And I want to challenge members of this house. If you fall sick in your constituency, which is this hospital that you can be able to go and be attended to with the care, or will you wait to be airlifted to Nairobi or out of this country? Mr. Speaker, we have a chance at this house to make sure that even yourself, your siblings, even the people who are very close to you who elect you, can be able to access to quality health care with proper medication, with quality care, even at the village level, because we can have enough funding in our society. I know we have privatized a lot of healthcare, and I am not against anybody who has a health facility as a private person. They are assisting this government. But do we really want to commercialize health in exchange of how few people in this country? Many public officers, Mr. Speaker, civil servants and state officers use private healthcare due to comprehensive insurance coverage from their employers. This has diverted resources away from public hospitals, limiting their revenue and ability to improve. And if I will do a check now, Mr. Speaker, in this house we know we have a medical cover, which is almost at around 10 million per person. And this covers around 6 of our members in our families. Mr. Speaker, how many of us have visited Kenyatta National Hospital recently? Or do we all go to private hospitals? But Mr. Speaker, the other thing is, these people who treat us in private hospitals are the same doctors that we have employed in the public facilities. So we end up that they spend a very few minutes in the public hospitals and they rush to the private hospitals where they can make extra coin. Mr. Speaker, the impact of this mandatory use of public health facilities will increase funding for public hospitals, will have better access to health care, and will improve the public health system. Mr. Speaker, I had an experience in the private sector in Kenyatta National Hospital, where, Mr. Speaker, I went to admit my dad. And I was shocked, Mr. Speaker, that at this age and era, when you go and do admission, it is the private sector of Kenyatta National Hospital, which is a level 6, that you are given a basin to carry you, the patients, the things that they are given, the tissue paper, those things that they are given for admission. And then you pass through the accident and the accident place, you go through the lifts. And Mr. Speaker, entering even those rooms, Mr. Speaker, I was shocked that you're finding some old bathtubs, you're finding very old, Mr. Speaker, and you're in the private sector, the private section. I asked myself, then what happens to the people who are in the normal wards, Mr. Speaker? If we put our resources in Kenyatta National Hospital, which is our national hospital, where people used to come out from other nations to come and be treated. I think Honorable Nikal has the institutional memory that even before, even presidents would go for medical care and medical attention at Kenyatta National Hospital. Why did we go backwards? Where did the rain start beating us? That our public hospitals are in such pathetic condition. Mr. Speaker, we only have one national medical hospital, which is Mathari. When I was the chair, we had a privilege to go and visit Mathari. It is in very pathetic condition, Mr. Speaker. That is why we are seeing we have lost a doctor who went to a private facility. There's a story of that lady being struggled, a person who had a future, Mr. Speaker. But because we have very limited spaces, mental health is a challenge currently in this Republic of Kenya. But how many public health, mental health facilities, even at our level 5, at our county level, Mr. Speaker, can anybody, our young people, go and attend and get proper mental health checkup? Mr. Speaker, if you look at Mathari, and that is our only national institution, then I am lost, Mr. Speaker. We have a huge percentage of population of Kenyans who cannot be able to afford going to the private facilities, Mr. Speaker. And I'm not saying that once you have this, you cannot go to the private. If you have your own money, if you have your private insurance, you have access and you can attend and you can go to the private. And if there's something that cannot be treated in the public hospitals, then, Mr. Speaker, that's why I've said the ministry will come up with a policy. I am not limiting anyone. But let us first support our public institution, Mr. Speaker, so that we can be able to improve. Mr. Speaker, I want to challenge members of this House because if you look at the education, we find that when we used to have the 844 system, children could go to private primary schools and they will all struggle to go to public secondary school because the public secondary schools were well managed, they had good teachers and the students were passing very well. But Mr. Speaker, we shy away from attending to our public hospitals because we are afraid we might get congestion. And why do we have congestion in these hospitals? We don't have enough doctors. We don't have enough nurses. We have had even patients being killed. There's not even good services or even security. Mr. Speaker, if you're able to finance our public institutions and especially the health services, the health hospitals, Mr. Speaker, then we can be able to empower them and make sure that we have good quality education, with good quality healthcare in Kenya. Mr. Speaker, we need proper infrastructure investment and consultant parks enriched, which will improve public health services. And with strategic investment in the infrastructure of our public hospitals, we can elevate their standards to match those of private institutions, ensuring that there is continuous availability of health products and technologies that includes drugs, the latest diagnostic equipment and consumables. A well-equipped public hospital with modern technology, sufficient medical supplies, and improved working conditions will enable healthcare practitioners to provide quality services that meet international standards. Furthermore, increasing the remuneration and incentives of medical professionals working in public hospitals to match those of their private sector counterparts will encourage them to dedicate their time and expertise to serving the public sector effectively. Countries such as Thailand and United Kingdom have invested heavily, Mr. Speaker, in their public health system, ensuring that both ordinary citizens and public officers receive world-class health care without seeking private alternative. In fact, Mr. Speaker, private hospital care in UK is 3 times more expensive than public sector care. So, Mr. Speaker, I would want to urge this House to support this motion. What I am just saying is that we need to have a policy by the Ministry of Health so that, Mr. Speaker, we can make sure that we have enough funding. If this House, Mr. Speaker, have 10 million cover, times 349, that is already 349 million only from this House that can be able to support our public health care, Mr. Speaker. I want these members to have confidence in their facilities, though health is devolved from level 5 and going down, Mr. Speaker, that when you are in your constituency, your child falls sick or you have gone to stay in the village, or you yourself, you can confidently walk in and find a doctor. Mr. Speaker, if these doctors know that any time a member of parliament would walk in and they, come for a medical attention, we will have them there on time, we'll have quality services. And finally, Mr. Speaker, for this House to believe that the public health facilities can work, I urge all of you to visit it's not very new, but it's the modern Kenyatta University Teaching and Referral Hospital. Just take a tour. Tell me which hospital in this Kenya, or even in East Africa, or even in Africa, can match the standards that we have. The modern theaters that we have in KU, we have the PET scan for cancer, we have everything that we need. And KU Soon we'll have a 300-bed facility for children only, a children's hospital, Mr. Speaker. Why then can't we support our own? Instead of spending a lot of money going to pay a public facility, a private facility, why don't you spend that money, which might be even half or quarter, to the private institution? Make sure our children are employed. Make sure that our young people who cannot afford, Mr. Speaker, and we have the Gen Zs and their majority, who cannot afford to pay for themselves to go to hospital, and then they will have access because the money will have gone back to this public hospital. Mr. Speaker, I beg to rest my case there, and I kindly ask this House to join me and support this motion. And I ask Honorable Ziggy, Women Rep Taita, to support and second. Thank you, Mr. Speaker.
The member for Taita, Taveta.
Thank you very much, Speaker, for this opportunity. And I want to begin by also thank you, Honorable Sabina Chege, for bringing such a very important motion in such a time where it is really needed on matters health and most importantly, universal health coverage. Mr. Speaker, as we are aware, it is a right of every citizen to access good health care, quality health care for that matter. And Mr. Speaker, talking of our public health care, if only we can all support by getting the supporting, empowering the public hospital with good infrastructure. Mr. Speaker, we are all able to utilize the public health services. Because, Mr. Speaker, in most cases, majority of doctors, medics, who even work in those private hospitals are the same people who also, they are civil servants who work in public hospitals and at the same time work in the private hospitals. So, Mr. Speaker, if we can give, we can be keen on our public hospital and give them the resources that they are needed, then, Mr. Speaker, it is possible that all of us can make use of the public hospitals. Mr. Speaker, I have cases in Taita Taveta of late on matters healthcare and public hospitals, whereby we have a number of maternal deaths in Taita Taveta, Mr. Speaker, which is not interesting at all. We have lost women giving birth, Mr. Speaker, in the recent days. Mr. Speaker, as I pass my condolences to the family, including a family of MCA, I want to say that, Mr. Speaker, and I have a statement on the same, but then I want to take this opportunity to support and second this motion by Honorable Sabina Chege by saying, Mr. Speaker, we need to...
Members, order. Shall we listen to the Honorable Member for Taita Taveta in silence? Go ahead.
Thank you, Mr. Speaker, for protecting me. It was a bit noisy, and now I can concentrate and focus. But I was winding up my statement by saying that, Mr. Speaker, I second this motion that we need to have a policy on matters universal health care and support to the public health institutions, especially public hospitals, so that, Mr. Speaker, these hospitals are able to give the services that is required to all the citizens. Thank you, Honorable Sabina, for bringing such a motion. Thank you.
Have to end by...
Mr. Speaker, I second.
Thank you. Oh, members.